Welcome to What's Brewing with Berman. I'm Russ Berman, president of the SSO this year, and the only thing I love more than coffee is having a great conversation with SSO members over a cup of caffeine. The goal of this video series is to have a relaxed and informative conversation with SSO members like you who are doing innovative and interesting things in the area of cancer care and cancer surgery. My guest today is Dr. Kimberly Kopecky, Assistant Professor of Surgery and Surgical Oncology at the University of Alabama at Birmingham. Dr. Kopecky has a particular interest in how and how often surgical oncologists elicit patient values in their oncologic care, and Dr. Kopecky is presently running a nationwide survey on this subject. Welcome, Dr. Kopecky. It's great to have you. Let's start the conversation by taking a sip of coffee from your SSO mug. So welcome. I'm really interested in why you decided to start this study and why this subject is so important to you.
Yeah, absolutely. Thank you so much again for having me and for opening this conversation to the whole society. I think I'm a very junior attending, having only started my clinical practice about a year and a half ago is when I graduated from Surg-Onc Fellowship. And as I was starting out, I was trying to think really hard about how is it that I elicit patient values and what is it that other people are doing to make sure that the surgical recommendation that they're making for patients that are facing often high-risk surgery is aligned with what's most important to patients.
That's great. And could you clarify, is this, we often think of patient values and kind of goals of care in terms of end of life decisions and palliative care, but it sounds like you're considering this for even at the initial consultation.
Absolutely. I think that surgery is a force of good for helping people live longer and better quality of life. And so I think it's really important that we are honest with patients about what surgery is and isn't capable of and what the downsides and trade-offs are. And knowing what's most important to a patient, I think really matters in terms of making a surgical recommendation to make sure that what we are offering with surgery is capable of achieving the patient's goals.
So yeah, that's great. And I will say that I took this survey. I thought it was a great survey, but it's not just going out to the membership of the SSO. This is going out nationwide, I believe, to all surgeons. Correct? Could you clarify that a little bit?
Yeah, I sent it to all cancer surgeons, but it's made it to multiple countries as well, so it's pretty cool. But it is trying to gather the perspective of cancer surgeons because I think that that is unique.
Yeah, absolutely. And I think this is particularly important because cancer surgeons and the advanced practice providers we work with are often the first professionals that actually give the cancer diagnosis to a patient. And certainly when the disease, if it does progress or metastasize, we're usually the first person to have that conversation with them as well. Does this increase our obligation to elicit patient values and priorities early?
Yeah, absolutely. I think that kind of knowing what the patient's goals are and what it is that is most important to them does like drive our recommendations in surgical decision making. So, um, you know, I asked in the survey, are you eliciting patient values at the first meeting, at subsequent meetings, only when the disease progresses, or only when there's like a clinical de-escalation of care that's kind of being considered on the table. And so I'm hoping to learn from the survey, when do people do this? I do think that when we do break difficult news for patients, I don't know that that has to be the exact moment where we concurrently elicit values, but I think we should be eliciting values, or it's prudent to consider eliciting values when we're talking about making decisions.
Yeah, I agree, and it certainly makes sense to do it, early on, as well as
Yeah.
when there's progression or changes in the patient's status. But that takes some time. It does take time in the consultation to kind of pause and discuss these. I think we kind of somewhat do it organically, but to be more intentional and complete about it does take some time. So, how does a surgical oncologist or advanced practice provider reconcile that additional time with our increased pressure to see more patients in a given clinic day, as we're all aware of?
Yeah, I think you're right. I think it does take a few extra minutes, but I also do think that if you elicit patients' values and their goals early in the clinical consultation, it can save you time, actually. If you learn that there's no way in heck that this patient is ever going to want to have a big cancer surgery that's going to put them in the hospital for 7 to 14 days and, require X number of ICU days and the potential for a rehab admission, and you can establish that within the first 5 minutes, then you just saved yourself a 25-minute consultation outlining risks and benefits when that that's not something that they'd be interested in pursuing. So
So and probably also, phone calls, etc. It's a really good point.
I ask 2 questions to every patient that I meet for the first time, and that's it. And I have elicited patient values in probably under 3.5 minutes.
Yeah, and that's great. And you're right. I mean, looking at it from that perspective, it probably saves us time. It probably saves our advanced practice providers we work with time and our staff time. Not to mention the fact that when family members, friends, etc., get involved, it probably could be a more directed discussion. So, really good point. What's the next step? When would we expect to? When does the study officially close if it hasn't already? And when do we hopefully expect to hear more about this?
And I'm really excited to kind of start to evaluate the data.
That's great. Well, Kimberly, thank you so much for joining me today. This is such an important topic and such a valuable discussion, and we're all looking forward to the results and hearing more about this in the future. So thank you so much. Thank you for joining us on What's Brewing with Berman. If you're working on something that's interesting or innovative, or an SSO member who is, we'd love to hear about it, and maybe you could be my next guest. So I'll see you soon right here on What's Brewing with Berman. Thank you, Dr. Kopecky.